In a nursery, sometimes prematures get a necrotizing enterocolitis. What does that mean to you?
That's a disease that came along when our technology evolved that we could keep little premature babies alive. And when these little tiny babies, pound, pound and a half, 2 pounds, are born, about 10% of them get a condition where the blood supply isn't good to the bowels, they get swollen, they have a little blood in their stool, and half of those babies perforate their bowels and need an operation. So that's the scourge.
So they get like a peritonitis, because you said perforation?
Absolutely. That's the scourge of the bowels in the newborn intensive care unit. It doesn't usually happen immediately. It typically happens after they've been fed, and they can't tolerate their stool, their feeds. The little tiny baby often isn't fed for 3 or 4 weeks, and it's at that stage that this will happen. And you need to get the neonatologist very activated, the surgeon very involved, and half the time they cure themselves with antibiotics, not feeding them, and half
So
the
in other words,
time
it goes away with antibiotics and not surgery?
2-3 weeks of resting the bowels and no surgery, and half the time it needs emergency surgery.
What will that surgery entail?
You need a pediatric anesthesiologist. You got to keep the baby very warm. You have the baby on fluid antibiotics, and you make an incision on the abdomen, and you locate what bowel has lost its blood supply, and you remove it. So it's a resection of dead intestine. You're hoping that that's a small area of intestine. If it's a large area, the baby's going to be in the hospital a long time waiting for that remaining intestine to adapt and absorb enough calories so the baby doesn't need the intravenous calorie support.
If you lost a lot of bowel, there's a thing called short segment bowel syndrome.
Short gut.
Short gut, excuse me. Surgeons use that. What does that mean?
Short gut means that the intestine is not adequately absorbing calories. Short gut means the intestine is not adequately absorbing calories, that the baby needs some other way of getting carbohydrate, protein, and fat to stay alive, which today can be done through intravenous tubes, but that's not a perfect solution, and it's temporary.
What is the minimum you need to function?
It's a hard question to answer. They used to say you need 40 centimeters, about 15 inches if you had a little valve at your ileum and cecum, that you needed 20 centimeters, about 8 inches if you had, about 8 inches if you had an ileocecal valve, about 40 centimeters, 15 inches if you didn't. But now it's hard to say if heroic efforts are made. But when you have such a small length, it's a serious problem, and it's many, many months in the hospital. It needs long-term care, pediatric gastroenterology, neonatology, surgeons, all working as a team. A lot of support for that family.